Good evening to those of you listening or viewing via our various media houses. Thank you for joining us for this COVID-19 update. Let me recognize the Minister of Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre, Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Letitia Lestrade-Wyke, Chief Medical Officer, Dr. David Johnson, National Epidemiologist, Dr. Shaludin Ahmed, Officer in charge in the Office of the Chief Environmental Health Officer, Clara Charles, and also with us, the Acting Deputy Chief of Police, Davidson Valerie. Let's welcome first off this evening, the National Epidemiologist, Dr. Shaludin Ahmed.
Honorable Dr. Irvin McIntyre, Minister for Health, Wellness and New Health Investment, Mrs. Letitia Lestrade-Wyke, Permanent Secretary for Health, Wellness and New Health Investment, Dr. David Johnson, Chief Medical Officer, Acting Deputy Chief of Police, Mr. Davidson Valerie, Officer in charge in the Office of the Chief Environmental Health Officer, Ms. Clara Charles, Ms. Shinahari, Communication Officer, media and listeners, good evening. As of today, our active COVID cases are 6. Over the past week, we have had 2 new cases. They are Dominicans who returned from the USA. One is a 14-year-old male and the other one is a 45-year-old female. They are asymptomatic. One of them was identified at the airport following rapid testing, and the second one was identified at the quarantine facility following the day 5 testing. In total, 81 cases have successfully recovered and have been discharged from the COVID center. There are no deaths to date. Since the opening of the border on July 15, a total of 69 cases were detected using the PCR method. It should be noted that of these cases, 85% were detected through active surveillance. That is to say, they were detected through on-arrival screening, contact tracing, and routine screening of suspected cases. Our progress so far is very good indication that we are in right direction in fight against COVID. That means protocols that we have implemented, such as risk stratification during the pre-travel screening, on-arrival screening at the airport, and day 5 screening, as well as surveillance activities including contact tracing and community testing are working, and they are working well. Speaking of community testing, we plan to start another set of community testing from next week. Our target of population includes elderly folks in the nursing care setting, frontline workers at the Douglas Charles Airport, contact tracing team members in primary care, including staff at the quarantine facility, bus drivers, and other selected communities like the fisher folks in Forseza, in Woodford Hill, and Dewick community. Now, this community testing will be conducted using the serology method. That is an antibody testing method, and a total of 400 tests will be conducted. The objective of this exercise is to detect the level of exposure to the COVID virus in the community, as well as to detect the affected subgroup, if any at all. So with this, I thank you for your attention and have a good evening.
Our thanks to Dr. Ahmed for his continued surveillance of the COVID-19 situation here in Dominica. Just to repeat, 6 active cases at present, 2 since our last briefing, and those are imported cases from the United States. Next up this evening, we welcome the officer in charge in the Office of the Chief Environmental Health Officer, Clara Charles.
Thank you, Ms. Harry. Minister of Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre. Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Mistress Letitia Lestrade-Wyke. Chief Medical Officer, Dr. David Johnson. National Epidemiologist, Dr. Shaluddin Ahmed. Acting Deputy Chief of Police, Mr. Davidson Valerie. Ms. Shina Hari, Communications Officer, media, and listeners, good evening. The Environmental Health Department has played a critical role in protecting the health of the public during the current coronavirus pandemic for inspection, monitoring, and enforcement procedures. The department continues to monitor compliance of businesses to ensure that COVID-19 measures are maintained. For the period December 1st to 8th, 2020, a total of 88 businesses have been monitored. Additionally, the monitoring and surveillance of crew and passengers continue at the Douglas Charles Airport, Woodbridge Bay Port, and the Longhouse Port. The department also collaborates with other stakeholders in reviewing of applications for accommodations and public events, and also conducts inspections of accommodations. In this regard, the department will expect continued compliance regardless of any COVID-19 related operational disruptions to businesses. The Health Department, in collaboration with the Discover Dominica Authority, has been reviewing COVID-19 action plans submitted by accommodations. These plans outline in detail the measures that management will put in place to address all areas of operation to manage and mitigate the spread of COVID-19 among guests and staff. To date, there are 62 certified accommodations and 5 water sports service providers. These COVID-19 certified accommodations can receive guests coming from the bubble, low and medium risk countries. Recently, the Ministry of Tourism introduced the managed experience for the accommodation sector, which would allow for all visitors coming from high-risk classification of countries. This managed experience includes on-property managed experience, which would permit guests to access services at the property and enjoy all property amenities in a safe manner. The off-property managed experience would allow guests to travel from the property on certified taxis with a certified tour operator at specific sites for water and land-based activities. To date, there are 33 accommodations, free water spots, and free tour operators certified safe in nature. These accommodations can receive guests from bubble, low, medium, and high-risk countries. Hence, it is the responsibility of management to ensure that all health and safety protocols are adhered to and that the accommodation is in compliance with all the measures set out in the action plan that is submitted. Failure to comply will result in revocation of the certificate of approval and properties removed from the certified list that is found on the Discover Dominica Authority website or at the Douglas Charles Airport. A COVID-19 monitoring team with personnel from the Environmental Health Department, Ministry of Tourism, Discover Dominica Authority, and the Dominica Hotel and Tourism Association has been tasked with the responsibility to do spot checks to ensure compliance. To date, 2 accommodations were identified to be non-compliant and their certificates were revoked. Management was given the opportunity to implement all recommendations given, and the accommodations will be recertified if the standards have been met. The management of all accommodations visited thus far has been very cooperative. However, some of the shortcomings identified are as follows: lack of or inadequate documentation as it relates to temperature screening, training of employees, and cleaning and sanitizing. Records are an important tool that can be used to verify whether the measures set out in the action plan are implemented. Lack of or adherence to the environmental standards related to food hygiene. All food handlers must be certified. All food businesses must meet the requirements of the Environmental Health, Food Hygiene, and Restaurant Regulations of 2003. Facilities should be clean, free from pests to ensure that the health and safety of the guests are not compromised. Accommodations that are not up to standard can present a negative image to the tourism industry. Therefore, it is vital that accommodations address any health and safety issues to ensure that they maintain compliance. COVID-19 has clearly demonstrated that societies need to strengthen their resilience to pandemics and other emergencies. The role of environmental health has become a crucial aspect of health, particularly in the areas of water and sanitation, air quality, and waste management and generation, among others. We are therefore appealing to the general public to help us as we seek to help you. Remember and practice the 3 W's: wear, watch, and wash. Wear a mask, watch your distance, and wash your hands. Thanks to all the environmental health officers and the port health officers for their hard work. Thank you all, and good evening.
And our thanks to Ms. Clara Charles, who is the officer in charge in the Office of the Chief Environmental Health Officer. Again, the measures might seem stringent, but the environmental health officers have a responsibility to protect everyone, not just against COVID-19, but other infections as well. We thank them for their diligent service. Our next presenter this evening is the Acting Deputy Chief of Police, Davidson Valerie.
Minister of Health, Wellness and New Health Investment, Dr. the Honorable Irvin McIntyre, Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Letitia Lestrade-Wyke, Chief Medical Officer, Dr. David Johnson, National Epidemiologist, Dr. Shaluddin Hamid, Officer in Charge in the Office of the Chief Environmental Health Office, Officer Clara Charles, Acting members of the listening public, members of the media, good evening. I am grateful for this opportunity to address you this evening. Dominica, like many other countries, continue to grapple with the challenges of COVID-19. A number of protocols have been developed to prevent the spread of COVID-19, and the police have been mandated to enforce some of these protocols. One of the protocols is geared towards managing gatherings. As such, a number of conditions have been set for the hosting and promoting of gatherings. There are also protocols geared at people's attendance at gatherings. Therefore, I would like to remind the general public that anyone wishing to host an event targeting a gathering of 50 to 199 people must first seek permission from the Chief of Police. To make it more convenient for organizers, an event application form is available online at dominica.gov.dm and discoverdominica.com. The application form, Annex 1 and Annex 2, must be completed, signed, and submitted to Dominica to dompol at cwdom.dm. That is, dompol at cwdom.dm, or delivered to police headquarters. On receipt of the application form, the monitoring and inspection team will then make contact with the organizer of the event. A site visit will be conducted, and the team will confirm that the requirements and conditions stipulated in the application form are implemented. To date, a number of activities have been hosted successfully. We continue to encourage people to follow the guidelines and protocols in place. Let me reiterate that it is an offense for anyone, to be without a mask when in using a motor omnibus, hiring car or taxi or other public transportation. B, in a public building including supermarkets, retail and wholesale establishments. C, in a bar, market, or other similar business or place. D, in a public space including parks, riverbanks, and beaches. 2, it shall be unlawful for anyone to host or attend a large gathering. A large gathering is 200 or more persons. It shall be unlawful for anyone to be present at or promote, aid or assist in the promotion of a large gathering. It shall be unlawful for anyone to host a gathering of 50 or more persons without the permission of the Chief of Police. Police officers are authorized to disperse large crowds, or large gatherings, and anyone failing to obey the order of the police commits an offense. The Christmas season is usually an occasion for many festive activities. But in the advent of COVID-19, everyone must be exceptionally cautious. Therefore, persons are advised to be guided by the protocols regarding gatherings. The police are expected to have a more visible presence on the streets to discourage any unwearing of masks, and to encourage and enforce the wearing of these masks in a public place and in buildings, as well as to disperse large gatherings of 200 people or more. I wish to remind that the penalty for not wearing masks is $75. The police continue in our efforts to patrol the borders so as to prevent illegal entry and exit of persons. 13 vessels and $34,000 EC have been seized. 36 individuals so far have been arrested for illegal entry. Out of the 36 individuals arrested, 9 have been found guilty and sentenced. I wish to appeal to the public to continue to provide to the police information which will lead to the successful prosecution of persons involved in illegal entry and exit from Dominica. In closing, I wish to state that many people have been adhering to the protocols, yet it is evident that some are not complying with the protocols. I want to implore everyone to continue to follow the protocols and to cooperate fully with the health professionals and the law enforcement agencies in preventing any further spread of COVID in Dominica. Thank you.
Thank you so much to the Acting Deputy Chief of Police, Davidson Valerie. We cannot commend the police enough for their support in this fight against COVID-19. And our final presenter this evening is the Chief Medical Officer, Dr. David Johnson.
Good. Let me acknowledge the presence of the Honorable Minister of Health, Wellness, and New Health Investment, the Permanent Secretary in the Ministry of Health, Letitia Lestrade-Wyke, our National Epidemiologist Acting, Dr. Ahmed, our Acting Deputy Chief of Police, the one who keeps me active on a daily basis, Mr. Valerie, our officer in charge in the Office of the Environmental Health Department, Miss Clara Charles, and our very own Miss Harry. To you, the listening and viewing public, good evening. So to date, we have 0 deaths from COVID-19 in Dominica, as you have heard. Thanks God. All of our energies are focused in keeping it that way. 1 death from COVID-19 would be too many for us in Dominica. So although Dominica has been spared the worst, all of our efforts must ensure that the health system does not become overwhelmed in having to manage several severe cases of COVID-19 disease. So while progress is being made in the development and production of vaccines against COVID-19 in the scientific community, our plans to introduce new vaccines and the identification of key components to strengthen what we refer to as our expanded program of immunization in preparation for the vaccination against COVID-19 pandemic are taking place very actively in Dominica as I speak. So Dominica is committed in improving our national immunization services on a very sustainable basis in accordance with our national health and immunization strategies. To this end, Dominica has recently strengthened its partnership with Gavi and the COVAX facility for improving the immunization program for COVID-19 approved vaccines. The Ministry of Health, through its National Immunization Program, has been charged with the responsibility to develop a plan to introduce the COVID vaccine when and as soon as it becomes available. And I must tell you that under this COVAX facility is a facility which will ensure that all countries, including small island developing state like Dominica, will have equal access to the vaccine. So relying on the gains achieved over the years in immunization, as well as the successful implementation and introduction of a new vaccine which we had done last year, which is referred to as the HPV vaccine, that is the human papillovirus vaccine, in 2019, the Ministry of Health is very confident that all the strategies will be in place for successfully introducing the COVID-19 vaccine when it becomes available. With regards to planning and coordination, a planning, or rather a national COVID-19 technical committee is being established to deal with all issues as it relates to the COVID-19 vaccine in Dominica. And this committee comprises senior staff from the Ministry of Health and Wellness, senior staff from other relevant ministries, including there'll be representative from the Attorney General Chambers, and it will also include major NGOs, non-governmental organizations. This National Technical Committee will report on the progress made in the plans and implementation of the COVID-19 vaccine in Dominica. So this technical committee is the critical body for the successful planning, coordination, and implementation of the vaccine. In addition to that, we'll also have, in fact, we have also established in the Ministry of Health a technical working group which has been established, which will provide, it's in fact providing support to this National Technical Committee, is advising on resources that are essential for program implementation, and participate, very importantly, in monitoring and evaluation of all the mechanisms for immunization program for the vaccine. We are also establishing other subcommittees to ensure that when the vaccine is introduced, that everything will run as smoothly as possible. So there are other committees that are being introduced, which will deal with service delivery, issues relating to the vaccine cold chain and other logistics, looking at issues related to safety, including injury prevention and monitoring. Whenever any vaccine is introduced in Dominica, we always monitor through the guidance of the WHO, the Pan American Health Organization, what is referred to as adverse events following immunization. So, what are some of the target populations that we're looking at? Selection of the target population to be vaccinated is guided by the recommendation made by the Pan American Health Organization Advisory Group, and also looking at our present COVID situation. So presently, the intention is to vaccinate the following priority groups when the vaccine becomes available: our frontline healthcare workers, our first responders, including fire and ambulance, our police, customs, and immigration, who are all frontline workers. Very importantly, persons with chronic diseases, to include patients who have cancer, hypertension, diabetes, or persons with chronic kidney problems, and our elderly, persons over 65 years old. In terms of strategies for delivering timely vaccination, the vaccine will be ordered utilizing what we refer to as forecast demand for vaccine, which we normally do using a PAHO revolving fund under which we currently procure our vaccines. We'll be liaising with the Pan American Health Organization on vaccines that are approved under the COVAX facility. All vaccines, and I repeat, all vaccines procured in Dominica will be those that are approved by the World Health Organization. We'll be using various outreach strategies, and vaccination will be done at various facilities, including our primary healthcare facilities, at our hospitals, our elderly care facilities, at private clinics, and even on the blocks. All of our primary, in fact, our essential primary healthcare staff will be trained to deliver vaccines simultaneously throughout the island. So the intention is that when the vaccine becomes available in Dominica, it will be done simultaneously on the island. So now that we have heard something in terms of our plans for the introduction of the COVID vaccine, I would like to address a few other areas of our COVID pandemic response before I leave the podium. We are constantly seeking to improve the services that we offer to clients, both at the Dominica China Friendship Hospital and within the primary health care services. With regards to services at the Roseau Health Center, we're working very, very hard to improve the facility where currently the PCR swabbing for persons wishing to travel is being done. We are very optimistic that in the next few weeks, our clients will be served in a much more comfortable air-conditioned facility at the Roseau Health Center. This will also bring much comfort to the primary healthcare staff who have been working tirelessly to do the PCR testing, or swabbing rather. While on PCR testing for travel purposes, let me say this. What we have noticed sometimes is that persons requesting PCR tests for travel purposes often book their flights prior to securing a scheduled appointment to have the PCR test done. Now, this poses a bit of a challenge, since there is a limit to the number of tests which can be processed at our national laboratory at any given time. We also wish to remind persons traveling that the turnaround time for getting your result is 48 hours. I repeat, the turnaround time, and that is very good compared to other countries. The turnaround time for getting your results is 48 hours. So please, we implore you to try to plan your travel properly, bearing this in mind. Our national laboratory runs 24 hours, 7 days a week. And sometimes we can try, or we try to generate the result in less than 48 hours. But the test that is done through a computerized equipment. And we cannot make it work faster, nor can we get our staff to process the result faster than it has to be done. To date, we have done over 6,437 PCR tests at our national laboratory, and that is commendable. Sometime last week, in fact, Wednesday last week, during this press briefing, our quality manager at the Dominica China Friendship Hospital did an excellent job. I think everybody who listened and viewed felt the same way. Did an excellent job at the press conference held last Wednesday, explaining the protocols which we have in place at the Dominica China Friendship Hospital to protect both our patients and our staff. But there are 3 things which I would like to emphasize at this point. 1, we continue to have a no visitor policy, but items for your family members at the hospital can be dropped off at the ward. So please remember the no visitation policy. Please call the hotline if you have flu-like illness. Do not just show up at the accident and emergency department or at the health centers. But let me say this. While we encourage patients with flu-like symptoms to call the hotline first, on no account, and I repeat, on no account would we want any of our patients, particularly or patients with underlying medical conditions such as diabetes, cancer, kidney problems, or even or patients suffering from HIV or chronic lung problems, etc., who have flu-like symptoms and who call repeatedly and cannot get through to stay at home and get worse. Yes, we would like you to call first, but if you're getting worse and cannot call or not getting through, please get medical attention as soon as possible. The third thing I'd like to say here is, we'd also like to appeal to patients seeking attention at the healthcare facilities to be upfront, to be honest with us, and tell us of any recent travel history that you have. And also tell us if you come in back door, or any contacts you may have had with any COVID positive person or any person that is suspected to have COVID. By doing so, this will clearly help our nurses and doctors to manage you better. The fight against COVID-19 pandemic is far from over. So let us not drop our guards as we prepare to celebrate during the Christmas season. The essential public health measures of wearing masks, hand washing and using alcohol hand sanitizer, and cough etiquette cannot be set aside even after we introduce the best vaccine in Dominica. So let us all play a part in the fight against COVID-19 pandemic. And I wish everyone a peaceful Christmas season. Thank you and good night.
And thank you very much to the Chief Medical Officer, Dr. David Johnson. And thank you for that reassurance that a vaccine is forthcoming and we here in Dominica will have access to that vaccine. However, as we continue to await that vaccine, we implore the general public, as the Chief Medical Officer stated, to continue to adhere to the protocols. The protocols have been working. For those of you who are traveling, we do not take for granted how taxing that can be, but especially now, the protocols are important. We will continue to do our best to make the process as easy as possible. If you have any questions regarding those protocols, feel free to call the hotline at 448-2151, 448-2153, 448-2156, 611-4325, or toll free at 1-800-219. All of the information on the protocols and also the health questionnaire available at dominica.gov.dm. We'd like to thank the general public so far for their cooperation with the mask mandate and other protocols. And again, for those of you who might have tuned in late, 6 active cases here in Dominica, 2 of them new since our last briefing, and those imported from the United States. We thank you for your attention, and we wish everyone a good evening.